Hey everybody, thanks for joining us today, and we wanted to have a conversation with you today about a very important topic, and that's mental health. May is Mental Health Awareness Month and has been Mental Health Awareness Month since 1949. Each May we do recognize this issue, and today I have Dr. Dean Hickman, who is our System Chair of our Behavioral Health Services, and Tracy Scarrow, who's our EVP and Chief Human Resource Officer, here to kind of have a conversation about mental health and what's happening. And just a few stats to just throw out to you. According to the American Psychiatry Association, 20% of American adults will experience some form of mental illness in their lives. 1 out of 24 people have a serious mental illness such as major depression, bipolar disorder, or schizophrenia. 1 in 8 have a substance abuse condition. And specific to this past year, the CDC reported a doubling of depression and anxiety as we've all been dealing with and going through the COVID-19 pandemic. So it's certainly, these are very large numbers, it's a very big issue. And what we wanted to do is spend a little bit of time today talking to you about our mental health services here at Ochsner and what we're doing to provide the right services and right support to all of you as our team members here at Ochsner. So we're just going to jump right in, and Dean, I know that there's been a lot of impact from COVID-19 this year with mental health. So
Sure.
Maybe tell us a little bit about what you've seen over the past year and the impact on Louisiana, Mississippi, and really across the country
Sure.
for mental health.
Absolutely. So obviously, it wasn't just a health pandemic. It turned into an economic downturn. It turned into social isolation. It turned into people with new roles, whether you were in healthcare with a new role, whether you were a parent who is now working at home, who is also now expected to educate your child with homeschooling. So, lots of stress. The CDC speaks to that. The Kaiser Family Foundation is a nationwide group, does a nationwide poll, and they do it every year. The spring of last year, it was about 45% of Americans had significant levels of depression and anxiety, whereas the previous year was only 10%. So, there was certainly a lot of stress going on. Suicide was a factor of many people's concern, and thankfully, it actually looked like the suicide rate actually went down by 5%. Unfortunately, accidental overdose deaths dramatically increased. So when you're not working, maybe there was other forms of money you were getting or so. The opiate crisis, the synthetic opiates, the death rate was over 90,000 for 2020, whereas about 70,000 in 2019.
Wow.
So there were, and those were all things that we saw regrettably in Louisiana, Mississippi. I was doing still some inpatient work at that time in Laplace, and you see all these issues just coming in. Domestic battery, because spouses weren't used to being with each other. Substance abuse on top of that. So regrettably, we became a microcosm of what the rest of the nation was seeing.
Now, tell us a little bit about the difference. I know we hear these terms, the difference between mental health and mental illness.
Yeah. So when people speak of mental health, you're really talking about mental well-being. This is a state of mind where you're functioning at your full potential, you're coping with everyday stressors, you're making a positive impact, on your community. Whereas mental illness, we're talking about various health conditions that do impact how we think, feel, act, and thus those relate to how we function, interact with each other. And the key issue there is they're treatable. That's one of the missions today is they're treatable. People endure terrible things and they become depressed, and the danger point is some people say, well, it's natural to be depressed after that. And I say, well, it's also natural if you're a motorcyclist to be hit by a truck and bleed from the head, but we don't tell you that it's natural without intervening. We take an ambulance and do something. So it's the same thing with mental illness. There are consequences and reactions that people have, but we still want to address them and treat them.
And I think part of the challenge is, there's been this stigma with mental illness, and I guess my view of this has been everybody goes through a period in their life or situations in their life that they face these things. They face depression, they face anxiety, or worse.
Yeah.
So. But many of them are temporary.
Right.
So any thoughts on that?
Yeah. Well, I think there's more and more acknowledgement of this, and advocacy groups, National Association of Mental Illness speak to this. Celebrities talk about their condition. So, it's getting, less and less. And I'm always surprised at how freely people meet with me in public, and when they find out what I do, they're very acknowledging of the help that they or a family member got. So, it's decreasing, but there's still pockets of stigma that happen, and whether it's professions or socioeconomic groups or ethnic groups, and so there's still more outreach to do to decrease the stigma.
Now, I know one of the things we've made a commitment here at Ochsner is to expand our behavioral health services significantly. So maybe talk a little bit about what we've done there with number of providers, facilities, and whatnot from a mental health perspective.
So you actually get credit for this. It was about 2 years ago today in Fairhope that you came to me one night and said, I'm hearing about all the hits that we're getting on mental health in our social media. I'm going to say that you're going to double your division in 3 years. Can you do that? And I said after 2 seconds, sure. 10 seconds later, I said, what did I just say? But I said, sure. And you announced it the very next morning to lead off the meeting. And we're about 70% there. And by May 2022, we'll have doubled our service line. We now cover from Houma, Morgan City, to Shreveport, Monroe, and all points in between. We now control 233 acute inpatient beds that range in age from age 11 to on up. We have ambulatory services throughout with obviously live in-person therapists, online therapists. We have the Ochsner Anywhere Care at night. We have teleconsultation to dozens of affiliate hospitals for their emergency rooms and wards. So we've done a lot of growth already in just 2 years, and I appreciate the support that you and Ochsner have given our service line to make that happen.
So, one of the things that we're always concerned about and want to make sure we do a great job of supporting our employees. And Tracy, I know one of the hats you wear is making sure that we have the right benefits, the right support for our employees. So maybe talk a little bit about what we have there and what we've done to expand our mental health benefits and services for our employees.
Yep. So as part of our employee benefit plan, we have our employee assistance program through ComPsych, and our employees can access that at any time, and they get 5 free visits to meet with a counselor, and then that also helps them to transition to their benefits program for other services that they may need. But we realized during COVID that that maybe didn't fit everyone, so we started looking at different options. And a couple of years ago, we created the Office of Provider Wellbeing, and we were really focused on physician well-being and different programs to help with engagement in our physician group. And now we realize that those well-being services really would benefit all of our employees. So during COVID, we expanded the well-being services to all employees, and we started with some series in OLN around well-being that our employees could access. And then we also created things like decompression zones for our employees to go and reset and relax when they maybe were working a shift, and give them an opportunity to reset before they went back to the floor. And as we were talking to employees during this time and getting feedback in the engagement survey, we realized that people were really struggling with things, and maybe they needed different options than just the EAP or what maybe we had to offer in-house. And so we had 2 opportunities with 2 kind of new apps that are out there. One's called Happy and one's called Cabana, that are focused on mental health. And so we decided to do pilots with both. The Happy app went live in March at OMC, so we're doing a small pilot there, and we have about 300 people that we've connected with at this point that are interested in using Happy. And Happy is connecting our employees with support givers that are really focused on loneliness. So during the pandemic, with quarantine and social distancing and not being able to be with friends and family as much, we found that this was something that people were struggling with. And so this is a way to help those individuals who just want someone to chat with from time to time. And then the Cabana app is focused on more group therapy in a virtual setting. So it's you'll sign up to be part of a therapy group on a particular topic of interest or an area that you need some support in. And then you'll be able to attend this group therapy virtually with others. And it wouldn't necessarily be with people from Ochsner. It could be for anyone else that's accessing the Cabana app. So we have these 2 new approaches to supporting our employees. And we're continuously looking at other ways that we can add to our mental health services for our employees. But those are just a few innovative things that we've been looking at.
And I know one of the things we've looked at, obviously, with our our Ochsner Behavioral Health Services, we're expanding providers, but we've allowed people to go outside of our
That's
network
correct.
and provided folks to seek services elsewhere if they need that.
That is correct. So if we are not able to provide the access needed for someone, we will definitely work with them to make sure that they can see a provider timely and that meets their needs.
So Dean, I know there's signs, when someone needs help. Like, what are the things that you see, or what are the signs that someone may exhibit if they need mental health services?
So, some of the more common signs would be changes in attitude, maybe a negativistic look at things, pessimistic, combined with some psychological effects of changes in energy, appetite, sleep, concentration, decision making. Regrettably, any uptake in alcohol, nicotine, or substance abuse would be other key identifiers where we try to, again, intervene and point some things out that, look, we've seen a pattern of just not acting the way you normally do. You're not isolating. The ICU nurses got together at the daiquiri shop last Friday night. You're the only one that didn't come. We're worried about you. So I think, reaching out to someone like that with a sense of like a cup of coffee moment, and listen and hear what they have to say, and then, give some direction to, well, why don't you talk to your primary care physician or a clergy member, or, call the Department of Psychiatry or the EAP or one of these new apps that we have. There's lots of help available. You just have to take that one step to initiate it. And actually with the Happy app, they're initiating it to some of the employees, just dialing into them or sending an email or a text saying, hey, do you want to be part of this?
So if I'm out there and I'm watching this and I do feel like I have a team member who's isolating, or I'm isolating myself, I know that I'm withdrawing from folks, what should I do?
Yeah, I think a supervisor is a great person because the supervisors know where to get help. They know enough people to go up the chain of command to ask somebody, and that's not uncommon that it comes to me. Whether it's an employee or graduate education, somebody reaches out to our department, gets to maybe one of our intake nurse supervisors or myself or my vice chair. That's really what I love to do, really, is reach out to someone who had not anticipated it. And it's often well received, and it's very non-threatening, it's confidential, and once the source comes to me for help, I don't have to give a report necessarily back to anyone, of course.
So Tracy, if someone's out there and they want help from EAP, how do I go about connecting with people? Where would I find that type of information?
Sure. So you can always start with your leader. So your leader should have information about the EAP. It's also available on our SharePoint site under Employee Resources. And then also your HR business partner or anyone in Human Resources can help connect you with the EAP or get you information about the Happy app or Cabana. We're always advertising the well-being series programs that we're offering, so the Silver Lining series as well as the other OLN programs. You'll see information come out about those through our communications process. So just lots of different ways, but always start with your leader or someone in Human Resources. They can help you.
So there's a lot of resource out there to help folks, and certainly this is a really important topic. And as we said, May is Mental Health Awareness Month, but really every month is. I mean, this is something we need to take seriously every month. Every day, someone or organization is having some issue, some challenge, some problem, and that's okay. It's okay. I've gone through it personally myself. I still talk to my therapist every week. She's probably tired of talking to me, but she still talks to me every week. And some weeks there's nothing going on, and some weeks there's a lot going on. But all of us could use that ear, that independent person or support that can help point us in the right direction and give us feedback and guidance. So please, if you need help, do not hesitate to reach out to EAP, to reach out to your supervisor, reach out to our Department of Behavioral Health Services to get some help. And most importantly, let's take care of each other. Let's continue to do a great job taking care of our patients each and every day, and we appreciate what you do to make Ochsner the great organization it is and to have the great impact on our communities each and every day. Thanks a lot, take care of yourself, and we'll talk to you soon.